dashboard is comprised of 4 primary pages. As has been announced previously, we have established a community vaccination goal that consists of 75% of our vaccine-eligible residents. That equals 190,596 residents that we're aiming to get vaccinated. The chart that you see here at the top, the bar chart, is illustrating the percentage of that goal where we're at. This is taking Weldon-Cooper population estimates from those demographic areas and applying them to localities of similar size to us, so localities within the Commonwealth that have more than 200,000 people. As you roll over each one of them, all of them are interactive and linked together. And you can see that Chesterfield is currently appearing by that methodology second on that list. One of the things that you also see in the table down below is the number of people who have received at least 1 dose, the number of people who are fully vaccinated, and then a daily average based on a 30-day sample of how many people we're vaccinating on a given day. That number is then taken and extrapolated out to what we're calling an estimated goal date. I will caution you that this goal date will change on a daily basis as VDH updates their data. And all it is doing is illustrating that 30-day average. The second page on here is a breakdown of vaccinations within Chesterfield as a locality. So it's important that we stress locality here and not health district. We'll get to that one in a minute. As you look across here, you will see all of the Chesterfield residents that have been vaccinated over the last 30 days, broken down by facility type. You saw an early version of this chart last week when Chief Center presented it. Down on the bottom, you can see the number of residents that have received at least 1 dose, those that are fully vaccinated by a 2-dose method, whether it be Pfizer or Moderna, and those that are fully vaccinated by the new Johnson & Johnson. Again, all of these are tied together, so if you want to see how many people on a given day were fully vaccinated with their 2nd dose, you can click on that and it highlights accordingly. So a good example of that is to click on the Johnson & Johnson one, which we've had 1 pod to push out so far, and you can see that it shows up there with the total number administered, et cetera. The numbers on the side over here, total first dose, this is referring to people who have received at least 1 dose of Pfizer and Moderna or people who have received the Johnson & Johnson. Fully vaccinated is referring to people who have received a 2nd dose of Pfizer or Moderna, as well as people who have received that single dose of Johnson & Johnson. And total doses here can simply be equated to the number of needles that have gone into arms. So whether it's 1st dose, 2nd dose, whatever. We then have the 3rd page here, which is very similar to the last one, but this is now looking at the health district. So now we're including the localities of Powhatan and Colonial Heights in here as well. All of the charts in here remain the same. Again, they're all tied together, so you can see on any given day where vaccines were administered and what the vaccination status of each of the citizens that received them were. The metrics over here are again calculated the same way: 1st dose, fully vaccinated, and total doses. The last page of the dashboard is perhaps the most exciting for us. This is where it allows us to get in and begin to really both examine the strategies that have been put in place, the vaccination strategies that have been put in place for effectiveness, as well as compare ourselves to other localities to see how we're doing. So here you can see we've got Chesterfield County and Henrico pulled up side by side. When you look at the 2 charts, you get that visual representation, and immediately you might be drawn to the larger blue slice over here on the Henrico side. That's the federal vaccines administered through that federal long-term care program that Dr. Samuel alluded to earlier. That's relevant to us because those doses are outside the sphere of the county's influence or control. So if we really want to see on an apples-to-apples comparison how one locality is doing versus another, we can control for that. We can pull it out, and then we can look and see that Chesterfield has administered 48,945 doses to 44,131. Again, when you compare the 2 pie charts side by side, you'll see that this pink slice over here representing other community health providers is substantially larger on the Chesterfield County side. That is both illustrating and reaffirming the collaborative approach that the health district and the county government has taken, because the providers that fall under that category are both the employee medical center and the fire and EMS pods that are administering vaccines.